So the first presenter is Nisha Sajnani. She's Associate Professor and Director of the Drama Therapy Program at New York University, where she is also a founding co-director of the Jameel Arts and Health Lab. How many of you have heard of the Jameel Arts and Health Lab? We could have spent the entire day today and tomorrow just talking about the work that Nisha and the lab is doing, connected in with the World Health Organization. It is phenomenal, stellar, amazing. We appreciate you. We appreciate your partnership with this conference in these 2 days. And we really appreciate you being here. We look forward to hearing what you have to share with us. Thank you.
Thank you. Thank you so much for the invitation, James and Sarah and Catherine. I've been inspired all day, making all kinds of notes about the connections I'd like to make between the work that I've been hearing about here and the work that's taking place all over the US and around the world. Sunil also gave us such a wide view of what's happening across the country, and we've remained inspired by some of these city-specific activations in particular to get a sense of the very rich ecosystem that exists. So it's I'm here to share with you the story of HoME, which is one of the projects that the Jameel Arts and Health Lab is leading. And let's see here. So the Jameel Arts and Health Lab, I'll start with a little bit of a story about that. I did see a few hands go up, and I'm thrilled to know that a few people know about the lab already. The lab came together very much motivated. I also need to do that. Yes, you're just looking. I will do it on both. Motivated by findings from the WHO's landmark 2019 scoping review, which pointed to significant contributions that the arts can make as low-cost, non-invasive, multimodal interventions. We've been hearing a bit about that throughout the day already. So low-cost interventions, multimodal interventions that can make a significant contribution to both health promotion, but also the treatment and management of disease. So the Jameel Arts and Health Lab was founded in 2023 as a collaboration between NYU, the WHO, specifically the regional office in Europe, but also headquarters and slowly growing to other regional offices as well. Culture Runners, which is, I can tell you a little bit more about these partners as we go, and Community Jameel. The primary mission here is to measurably improve lives through the arts and to scale the implementation of interventions for which there is good evidence towards realizing the potential of the arts in mainstream medicine and public health. So we aim to meet this mission in a number of ways. The first way is by mobilizing a network of affiliated researchers and labs engaged in this shared mission, as well as a network of policy advocates who are interested in acting on the evidence base and moving it into policy opportunities and frameworks that can increase access and opportunity. And so these are just a few of our team members and steering committee members, but of course the network itself is much larger, and it includes collaborations and researchers and labs around the world, including conversations and collaborations that we're beginning to form here at UPenn with James's lab, and I hope with some of the other initiatives that we've been hearing about today. I will say that we also aim to meet this mission by observing practice, by hearing about what's happening on the ground in specific spaces that we have a chance to visit. What are artists and social organizations and families and schools, community groups and institutions, cities and states doing and funding, oftentimes without the presence of evidence, because they want to, because we've been doing this for millennia, because we feel that it works, because we know it has inherent value. For example, the project that I'm going to share with you briefly about today took inspiration from mural arts, right here in Philadelphia, and the Porchlight program specifically, which was evaluated by Jacob Kremer-Teebs, I believe. I'm not going to put you on the spot as I look at you, Pate, from Yale School of Medicine, and Samantha Maitland from Philadelphia Department of Behavioral Health and Intellectual Disability Services, and colleagues who found that there were significantly positive effects on both participants in Porchlight programming and on the neighborhoods in which the projects were installed. We also aim to meet the mission by noticing those projects which have already been demonstrated to have a local impact and to see if there's value in moving them to scale. So in the case of the HoME project, we were inspired also by Hospital Rooms, which is a nonprofit in the UK, who shared their work with us when we began this initiative. Before we became the Jameel Arts and Health Lab, we launched the WHO Arts and Health Initiative in 2021 at the Met Museum of the Arts and at MoMA, and both Sunil and James were there for parts of that. It was a foundational moment which gave rise to the lab that we've developed. I'm going to share with you just a few minutes from the Healing Arts Symposium so you can hear about hospital rooms.
We started Hospital Rooms after a really good friend of me and mine was sectioned after a suicide attempt. We were really surprised by what a mental health unit looked like. To be honest, I'd never been in an inpatient mental health unit. And I was quite shocked by how clinical it was, how uncreative it looked. And when someone you know is really unwell, you want them to be in a place that makes them feel like they're comfortable or makes them feel like someone's thought about that space they're in.
Hospital Rooms is an arts and mental health charity that radically transforms mental health hospitals in the UK.
Over the past 5 years, we've worked with artists and mental health patients and staff to commission more than 120 ambitious co-produced artworks for more than 20 of the most challenging mental health units.
We commission professional artists to lead highly imaginative and adventurous workshops, from owl life drawing to creating film animations using 3D scanning. These workshops result in the creation of major installation-based artworks that transform mental health ward environments. We offer patients and staff creative opportunities on their own terms.
I think the work of Hospital Rooms is really important because what it really is saying is that there should be no barriers to culture, and there should be no barriers to people experiencing and living with art.
The health regulator in the UK and the NHS 5-year forward view cite mental health units as being inadequate and not conducive to recovery. We know that bringing art into these spaces can have tangible health benefits. Despite evidence to show that arts can help patients to maintain a sense of personal dignity and control in what are often distressing circumstances, access to art or creativity is extremely limited in mental health hospitals.
We see firsthand the impact that art and the access to creative activities has on people in mental health hospitals. We take a rigorous approach to evidencing our impact and have formulated an evaluation methodology in collaboration with clinical teams in the NHS and researchers at Norwich University of the Arts to better understand and to improve our work.
We have adapted the arts observation scale in a form that employs the use of emojis. The tool has proved sensitive to self-reported participatory arts-induced mood changes, even for very unwell patients in secure services. It has demonstrated mood uplift in all of our participants as a result of taking part in our workshops. By analysing patient experience data, such as PEDICs and PREOMs, we have seen increased patient engagement with the environment, staff, and community on wards. We have used the visual matrix methodology and semi-structured interviews to gather rich qualitative data about our work. These demonstrate positive culture change. Ward environments are perceived as less clinical and more personal. Staff well-being has been enhanced, and the quality of patient and staff interactions improved. In a project that is due to be completed this year, we have observed that the improved interactions between patients and staff has led to fewer incidents on the ward and less use of restraint, and subsequently increased instances of innovation in the service. In 2020,
There's more to that story, but that one's also available online. So the Hospital Murals Evaluation, or HoME again for short, falls under one of these main focus areas for the lab. And I'll say there's another overarching focus area, which is arts and population health. It really cuts across a number of these. So we're zooming in here to arts and hospitals specifically. And I'll just mention the arts and population health is actually going to be the focus of the next WHO study. So that first one came out in 2019. The next one will focus on arts and population health, taking a look at data sets from 49 different countries, if not more, but we have 49 at the moment. All right, so in HoME, we're tapping into the already significant movement underway to implementing insights from intentional design, from understandings about light and air quality and the materials that we use in buildings as it intersects with well-being, because whether we want to acknowledge it or not, the spaces we inhabit, of course, have an impact on us, have an impact on our mood, have an impact on our well-being. So in this project, we're asking, you know, what can a hospital look like, right? What is a healing environment? Another hat that I wear is I'm a faculty member in the Harvard program in refugee trauma. And for 10 years, we had humanitarian aid workers meet with us in the classroom. It's a beautiful classroom. It was in Italy, so it was already a very healing environment, I have to say. That was the point. Take them out of very difficult circumstances and let's just restore for 2 weeks. And we would ask them to show us a photograph of what constituted a healing environment for them. And 60% or so of the photographs were of, what do you think? What's that?
Nature.
Nature, yes, it's where you go, right? And then another subset of photos were of social connection, moments that brought people together, and then meaningful practices. And there were a whole range of meaningful practices, but not one photo was a small, dimly lit room, okay, with no windows and bad lighting. Not one. Weird, because somehow these same health professionals like myself would defer to these spaces, right? And not question it. Thank you. All right. Or maybe question it, but didn't feel like they had much of a choice in terms of what we could do in those spaces, right? So we're asking here, what is the value of murals for patients, staff, and visitors? What holds value for them? What meanings do murals hold for these different constituency group, for those who are involved in their creation, for those who are viewing them? So a few months ago, we began by reaching out to a combination of artists, of researchers, of healthcare administrators who we know have been engaged in mural practices in their hospital settings, in Ljubljana Children's Hospital in Slovenia, in Lagos University Teaching Hospital in Nigeria, NYC Health and Hospitals in New York, and of course, hospital rooms in the UK. And we've invited them to form a research team. I'm not spending a lot of time on this here, but there are several values that you would have heard Niamh speak about in the video having to do with co-production that we're really trying to live out in this practice as well. So this is a co-produced research study with this research team, including artists and researchers, practitioners from across the board who are working together to better understand the value and the impact of murals in these spaces and to form a nucleus around which we can develop a thriving, wider community of practice and a community of influence. So the current work, which is currently underway, is a scoping review to take a look at what's been done, of course, an evaluability assessment, which is the stakeholder engagement piece, finding out what documents, what, you know, for those who are close up to these mural practices, what is really important to them about it, and therefore what components really need to be part of the protocol that is developed in the formal evaluation. Right now, this morning, actually at 9 a.m., they started to look at the findings from the evaluability assessment. So that's happening right now. That will move into, of course, defining the protocol for a formal evaluation. We'll hope to expand that community of practice for anybody here and around the world who are engaged and interested in this particular intersection. And invitations will go out and will also be on all of the Jameel Arts and Health Lab website and other socials around that invitation. And then finally, develop a policy brief because we don't want, you know, this story or other stories about good arts and health practices to stay hidden. The whole point, or not the whole point, but one of the main functions, of course, of the WHO is to provide normative guidelines for what constitutes good health practice. And so our aim is to translate this evidence into useful recommendations which can be shared widely. This one here is a policy brief that we developed a couple of years ago, responding to an ongoing, of course, crisis of displacement. We're working on one looking at the intersections of arts, health, and climate, on brain health, and hope to continue in a number of other areas. You can anticipate one relating to arts in hospitals. And so as has been said several times today, I think we are, of course, in a very unique moment coming out of the pandemic, where the value of our well-being, as James was just speaking about, of the humanities and of relationships, as Sunil mentioned in the recent Surgeon General's report, have been taking center stage, right? Including the value of relationships between traditionally disparate communities and disciplines like the arts and health. Thank you so much.
Thank you. We've got time for questions.
Yeah, I don't think that's
Comments or questions? Yes, Sarah.
Nisha, who needs to see that policy brief? Like, who do you think really needs to, because this is such convincing evidence, and I'm curious, like, who,
Yeah, but we know it's not mainstream practice, isn't it? And so if we know that spaces matter and the design of spaces matter, and we don't want it to be about an exorbitant price tag that's attached to this, we want to think about creative partnerships, whether it's through social prescribing, or whether it's through really valuing artists as health producers and supporting those relationships, investing in those kinds of collaborations. We want this policy brief, and it's a great question because it brings up the question of audiences. Who is it for? And it's for multiple audiences, which creates a challenge. Ultimately, we want to be able to say in a succinct and clear way, and with the inclusion of a few case examples and stories and visuals, this works. And so if you're a healthcare administrator, consider it. If you're an arts administrator, there's a neat collaboration to be made. If you're in a position of being able to create funding, pathways, here's some language to use. Yes.
I worked for a couple of years in doing medical humanities work, and I found oftentimes that there is this kind of reticence. I think, or there's sometimes a little bit of doubt about the importance of that kind of work in hospital spaces. And I'm curious, as I'm a medical professional, but as someone who is, why do you think some of those barriers exist right now?
I think it has to do with some of those traditional silos. It has to do with how we've organized our knowledge bases. And I see that shifting. I think the lab that you've created is evidence of that as well, that welcoming of different perspectives and knowledge bases to say, well, how are we making, what is our contribution? And what might we learn from one another across urban planning, to history, to humanities, to sociology, to the numerous other disciplines. Medical humanities is certainly a part of this story. And I think people are paying attention differently because what we were doing has limitations, and that's just putting it very conservatively. Yes.
Thinking about your talk in light of the mural arts talk, which kind of had me wondering about the nature of the images that are installed in these various hospitals.
Yeah.
And I wonder about how those kinds of decisions are made. When it comes down to aesthetics, when it comes down to subjects, how do you decide what goes on the wall?
Yeah, that's such a great question. I looked at the evaluability assessment this morning that we were just finalizing and sharing out with partners. And it's certainly not a one size fits all, and content is context, context is content. The conversations that go into making decisions like that really matter for each specific space and the people involved in that space. And so in Harlem Hospital, part of the New York City Health and Hospitals Network, they have these historical murals as well as current murals reflecting the neighborhoods in which they are. And that really matters. And so it's not going to be take that mural and recreate it all around the world. The process by which you arrive at an answer to your question is part of the process that contributes to well-being. It's what contributes to the outcomes that we're seeing. Yes, good question. Yes.
You talked about this as part of a larger sort of hospitals initiative. And so I'm curious, I think there's sort of some self-evident reasons why murals, because people see them, they affect a lot of people, you can involve many stakeholders. But I'm curious, what were maybe some other things that were considered to go forward with this project rather than murals, and maybe how you seconded
Yes.
on that?
Music and pre and post-operative care, use of creative arts therapies, palliative care, the arts and oncology. There are so many examples, and I hope that we get to continue into a few of those. We started with this one because of some of the stories we've been hearing, and also because we saw it happening in a few different places. I will say that, you know, because it's a World Health Organization collaboration, we have to pay special attention to lower and middle income countries. We want to give special attention and focused attention on lower and middle income countries. And Nigeria qualifies partly in that category. And so we saw this happening there. And Slovenia also doesn't have a lot of light shined upon it when it comes to the kinds of practices that are happening across Europe. And so we wanted to take a look at, well, what's happening in these spaces? And then, you know, bring them into conversation with other spaces that might be better resourced, like hospital rooms or New York City Health and Hospitals. We're also looking at, you know, starting with practices that could potentially be promoted with greater ease, that don't require high specialization, even though there's certainly a room for that as a creative arts therapist. I certainly see the value of skilled specific expertise, but we also know that's not going to address the 2/3 world majority that doesn't have access to these kinds of health professionals. So we need to be thinking broadly.
Beautiful. Thank you so much.